When he left Kenya for Malawi in 1999, it was to pursue further studies. But on realizing the opportunities here, he decided to stay. He is now the lead clinician at Kasese Health Centre and is also a successful businessman. I'm of course talking about Wilson Bett. Welcome to the show. Wilson Bett has been living in Malawi for the past 20 years.
Karibu.
When we arrived at the health center, an excited Wilson welcomed us with open arms.
Welcome.
Thank you. Hapa nasikia ni Murimbwanji.
Dudu bwino gainu. Welcome to Malawi.
Kasese Health Centre is located in Dowa district in the central region of Malawi. Wilson has been working here for close to 5 years now.
So it's an NGO run facility. Yeah. The sponsors are from America. Yeah.
So it's like a clinic basically.
Yes, it's a clinic. It's a clinic. We have maternity department, and then we have the OPD, general OPD. That's where we are going now.
The health center, run by Charities Africa, has a staff of 49 men and women.
It's a NGO which has got 4 programs, thematic areas, which is healthcare program, water program, agriculture, and child girl education. So I'm the lead in the healthcare program.
But how did he end up working so far from home?
Initially, there was my aunt who was staying here in Malawi, and she worked here in Malawi. She was working with Kenya Airways. So my father told her that is there colleges there for medical. So I was interested by then in medicine. So that's when she arranged with her that I should come to Malawi and apply for the course.
So in 1999, a young Wilson landed in Malawi and enrolled in Malamulo College of Health Sciences. And as you would expect, he was met by a number of challenges, one of which is language.
In the beginning, the first year, the people used to, when we started going for practicals in the ward, my fellow colleagues started translating for me. So they could translate for me, they could translate. But eventually they got tired. So they left me alone to work with the patient. That's when I said, no, I have to start learning this language. So I break the language till I started learning.
And 4 years later, he graduated with a diploma in clinical medicine. But Wilson was not done learning.
And then I went back again to school, that is Malawi School of Anesthesia. I did diploma in anesthesia and intensive care medicine. Then thereafter, I went to Exploit University, where I did a Bachelor of Arts in Health System Management. Because
of his training, it was not difficult for Wilson to get a job here.
The opportunity of work was very good that time. They could come to our school when we were in 3rd year and said, come and work with us before when we finished. So we were like choosing where should I go and work. In my class, we were only 12 years, and by then the School of Health Sciences were only 2 in Malawi. Yeah, and the College of Medicine were not there. They used to train students outside the country. So the demand for healthcare was very, very high.
Unfortunately, this was not the case back home.
So after finishing it, I had to come home for 3 months, thinking that maybe home I can get job the way. No, it wasn't the same. I was advised to go to Medical Council in Kenya, register, go for internship, and thereafter apply for work again, which was too much requirements. But here it was already straightforward. Finish school, you get a job. So I opted to hang around here.
On returning to Malawi, Wilson worked as a clinician at St. Gabriel's Hospital, St. Peter's Hospital, as well as Kamuzu Central Hospital, before eventually landing at Kasese, a change that he says was inspired by the need to help.
As you know, there are determinants of health. that is the education, that is social, and then age and geographical position and other factors. Here, there is high demand because of social factors. The poverty is very high here. And then the education background also, education also is another issue here, and other factors. But the major one is the poverty is very high. Hence, determines all these other issues. Health is affected with that. So there is need. There was very high mortalities, under 5 mortalities, maternal mortalities. You know, Malawi has got the highest of that figure. So there is need to reduce that mortalities. We have outpatient department, and then we also deal with women's health, that is maternity, antenatal, under 5, antenatal and postnatal, sorry. We also have children, 24 hours observation room, and we have public health programs, which are done by health surveillance assistants. And then we have mobile outreach clinic, which goes around in our catchment area. Yes, Muriwanji. Niribino.
Since taking charge of the healthcare program at Orange Charities Africa, Wilson has witnessed great improvement when it comes to the health of residents here.
The mortalities has reduced and the health-seeking behavior has improved. People are now coming forth to the hospitals, and unlike before, they used to go and take the homemade remedies, or traditional medicine, because healthcare was not accessible. So now we have mobile clinics, so the accessibility is not an issue now. And it's a free hospital whereby there's no fee attached to it, so many come for care.
And you will be surprised to learn that this is not his only source of income.
As a Kenyan, and as you also to survive, I had to do other businesses. So apart from that, we cultivate groundnuts. Like last year I cultivated 28 acres of groundnuts and we exported to Kenya. The last season I exported to Mombasa, and this season we are going to Nairobi. I managed to export, let's say, 1 container, which is like 600 bags. And then apart from that, I also import cars from Japan and sell them around. You need to irrigate the land, do irrigations.
Wilson is also a livestock farmer.
Welcome to my farm.
So how many goats do you have now?
Currently, I have close to 110. Yes, and this week they were born close to 20, this week alone. So there are small young ones around. So this I use it for...
He has a 5-acre farm a few kilometers from the center.
You know, when I arrived here, I saw the climate, I saw the first land. I said, well, why can't I do farming here, which is of this nature, of goats, because it doesn't depend on rain. You just have to keep them.
And it is not only in business that Wilson has put down his roots.
Since I hung around here for a long time, so when I went back home, I was like a visitor, not even a visitor, a foreigner again, because no one knew about me. So I had to come back. And then I married here. Home is where you are. So I married here. I have 2 kids. And my wife, we are working together. She's a nurse. So I used to renew work permit every 2 years. Then the immigration department told me, no, man. And I speak their language very well, I understand their culture. They told me, no, man, apply for citizenship, you qualified. After 7 years, I was voting. I've been voting almost 3 times.
Wilson is thankful for his life in Malawi and says that it has given him more opportunities that would not have been possible if he remained in Kenya.
The clinician in Malawi, they are exposed to do many procedures, unlike Kenya. Kenya, when I reached there, I was just told you are going to be working in OBD and you'll be working in a small section. You are not allowed to do cesarean section. You are not allowed to do INDs. That's the requirement from Kenya. But here, we could do all those. We are doing all those things. We do cesarean section. We do many operations. So you feel that fulfillment as a clinician or as a doctor. That is what you wanted in life. No one limits you much. You practice, you help people who are in need with your limited resources, but we could do more.
Wilson has no plans of relocating to Kenya at the moment. His dream is to one day open his own private clinic to help more Malawians in need of proper health care. And this is his parting shot on our Diaspora Bite.
There are opportunities around the world, and it's good there abroad, because you may squeeze yourself to somewhere in Kenya, struggling hard, life is not, you are not meeting the ends. Please connect with other people outside the country. Try, you may find your opportunity there.
What we can learn from Wilson Bett's story is the importance of daring abroad and not being afraid of venturing beyond your country's borders. Until next time, I'm Michael Zimanti.